Okay, so having laid that background for all to know, and I've mentioned some of the cardiovascular diseases we know, the place we will now come down to is what we call risk factors. Risk factors, R-I-S-K, risk and factors. So there are risk factors that make these cardiovascular diseases happen. Presence of these risk factors make cardiovascular disease happen. So what are these risk factors? By the way, we need to explain risk factors so that we are all be on the same page, right? I'm trying to make it as elementary as possible. What causes malaria? Anybody? What causes malaria? Mosquito bites, yes. Mosquito bites, it will bite you, and what will it inject? Plasmodium, yes. We have science students in this place. Yes, the mosquito has plasmodium inside. That's the microorganism. It will now inject it. When it sucks blood, that one will enter into your own system and now grows and multiplies, and you have malaria. So you and I can comfortably say that the cause of malaria is malaria parasites. Am I right? That plasmodium is a parasite, so it's malaria parasite. If you don't have strength to call the long name plasmodium, just say it's malaria parasite that causes malaria. So there needs to be malaria parasite in you that will now multiply and cause malaria. Am I right? That one is very clear. Yes, but when it comes to cardiovascular diseases, what causes them? Certain things are said to cause them, but there are cases where you are exposed to those things that are supposed to cause cardiovascular disease and they don't cause cardiovascular disease. What do I mean? Example, let me give another example. You know, smoking. And many of us over the years, most of us are adults way into our later years. We know that smoking causes lung cancer. If you know, raise your hand. Let me be sure that we are together. Okay? Most of us will know that smoking causes lung cancer. But if we are careful, or if we have looked around, there are men that are up to 90 years that have smoked from age 30 to 90 and they don't have lung cancer. Have you seen such people? Yes, there are people that have smoked 20, 30, 40 years and they don't have lung cancer. So, for us medically, we will not stick our head and say that smoking causes lung cancer. Unlike malaria, you are sure that if malaria parasite multiplies well, it must cause malaria. But smoking doesn't always cause lung cancer. So you will not say fully that smoking causes lung cancer. Rather, we say smoking is a risk factor for lung cancer. Do you now understand where I'm going to? What I'm trying to say is that many a times when you see people who have smoked for a long time, a greater percentage may come down with lung cancer. Not all. That's what risk factors are. Things that you consistently see and this disease will likely happen. That's what a risk factor is. So, for the cardiovascular system, what we have are risk factors for cardiovascular diseases. It's important to know these risk factors because it's these risk factors that you and I will alter and will be better off. We will help our hearts, help our cardiovascular system live healthy and strong. So that's the essence of knowing these risk factors. Basically, some people can classify these risk factors as modifiable risk factors, as in modifiable risk factors on one side, non-modifiable risk factors on the other side. It means that this side you can modify them. This side you don't get what you go into. You dey there be say e dey. You can't modify them, non-modifiable risk factors. Let me start from the non-modifiable risk factors. Why I say this topic is apt for this group. One of the constant thing in the class of non-modifiable risk factors is aging. Age. Whether you like it or you don't, we all grow be so. Yes. With each year, you grow older. So aging is one risk factor for cardiovascular disease. It means that as people age, elderly people, tail part of middle age elderly people, the propensity for these things to happen becomes higher. That is why if you sample, get that device that uses checking BP and check the blood pressure of people here and categorize them, you will notice that majority of the people that have hypertension are amongst the elderly people. The older, the higher the risk. The younger men and women, few of them, just very few will have. So you can't help the fact that we all age. So as you age, your risk for cardiovascular disease increases. So that's one non-modifiable risk factor. Another non-modifiable risk factor, which always makes us laugh in medical school, is male, being a male. Being a man, male gender, is one of the non-modifiable risk factors. We always argue in school, everything cardiovascular disease, they say male risk factor. Why? We are not very sure why it's seen more in males. Although some will say at a younger age, the hormone estrogen that women produce is protective to their cardiovascular system. So that's why when a woman goes beyond menopause, the risk starts equaling that of men, because estrogen will start, production of estrogen will drop in them, so the risk becomes the same with men. Actually, post-menopausal, the risk is the same. So one non-modifiable one is gender. You can't change your gender, so it's there. Another one that is here with us too is race. Yes, the black race has higher propensity, higher likelihood for cardiovascular disease. We do not know why, but race, RNCE, or ethnicity, if you want to use ethnicity, fine. So the black race has a higher chance of having a cardiovascular disease. So it's been found from